Hello, and welcome to the video for the first module, the Introduction to Cultural Competence, in which we explore basic ideas related to cultural competence and the impact of cultural competence on therapeutic outcomes. We will start off addressing the concept of decentering, and this perhaps will remain a thematic element of the course, which is to say, can we, as mental health professionals, and indeed as humans, try to adopt other perspectives on the various sorts of issues that we confront in our professional lives, understanding that there are other ways of understanding mental distress, indeed of what is normal and otherwise. We will introduce this concept and play with it and invite you to experiment with this idea of decentering. We will also clearly simply define what is intercultural or cultural competence. What does that mean? As we will see, it's a combination of words that not all of us are terribly comfortable with, but it is pretty much standard in the field and hence it is the one we have adopted. The one thing we always want to avoid is the idea that we can ever become fully culturally competent, knowing that there will always be limitations to what we are able to do. We will talk about two of the key components of cultural competence. Indeed, we can say that cultural competence exists as a means of overcoming the barriers that prevent the delivery of quality care to patients who are culturally, racially, religiously, or otherwise different. We can see two basic sources of these barriers: internal to the individual, aspects related to their, you could say, psychology which prevent them, and there are external barriers, which, as the word sounds, has to do with their access to care due to, for example, a lack of language facilities in the center, opening hours that don't work with their work schedules, and so on. We will also address the difference that is very much related to what I just said between individual and institutional cultural competence, with the idea that for all you as a clinician may be very culturally competent, if your institution doesn't provide you with the infrastructure necessary to respond to the needs of our diverse patients, it will be very difficult to provide that level of quality of care. And finally, in this first module, we will go over some literature on the relationship between clinical outcomes and cultural competence. We have to admit beforehand that this is a complicated field, simply because cultural competence is rather difficult to measure in and of itself, and perhaps even more so, measuring the outcomes or designing a study that can definitively demonstrate the impact of cultural competence is rather elusive. There is, however, a whole slew of literature on demonstrating the importance of various aspects of cultural competence, as will be elaborated upon over the course of the first module and the modules to follow. So once again, I welcome you very much to Module 1, and I will see you online. Bye-bye.